Welcome to the Houston Methodist CABG and Valve Discharge Teaching Medication video. This video is designed to provide guidance for teaching discharge medications for your CABG and Valve patients. Hello, my name is Kaylee and I'm a clinical pharmacist here at Houston Methodist, and I'm going to teach you about your heart medications.
Okay.
Your doctor is sending you home on some new medications that I want to discuss with you. I would like to go over each one of them with you, answer your questions, and make sure that you know how to safely take them once you go home.
Okay.
I will provide you with some printed information, and then we'll go over your discharge medication schedule as well. First, let's go over the medication schedule from your discharge paperwork. This first section here provides a list of new medications, and we'll go over them individually. The next section are actually medications that you were taking at home that we didn't make any changes to. The third section here are medications that you were taking at home, but we have changed since you came into the hospital. And then the last section here will be medications that you will stop after you go home. Your doctor has prescribed you aspirin. Aspirin is the blood thinner that actually works by keeping your platelets from sticking together. This is a very important medication to keep the blood flowing smoothly through the new bypassed vessels and along your valve. You will take aspirin once a day by mouth, either with food or without food. But if you notice that it causes an upset stomach or nausea, then it is best to take with food.
Okay.
Possible side effects of aspirin include heartburn, nausea, vomiting, bleeding or unusual bruising, and stomach or intestinal ulcers or bleeding. Although rare, sometimes serious side effects do occur, and notify your doctor for unusual or excessive bleeding. So this may be black or tarry stools, red or dark colored urine, blood tinged sputum, or if you cough up something that looks like coffee grounds, red spots on your skin, or unusual bleeding from your gums, your nose, or your eyes. It is important to not take any additional over-the-counter medications that contain aspirin or non-steroidal anti-inflammatory drugs called NSAIDs. These medications include Motrin, Aleve, naproxen, and ibuprofen. Do you have any questions?
Can I take the aspirin with my other medications, and can I take it in the morning? Does it matter morning or night?
Those are great questions, and yes, you can take your aspirin with all of your other medications, and it's safe to take in the morning or at night, just as long as you take it at the same time each day.
Okay, I understand.
I do want to make sure that we have the correct pharmacy on file so that your prescriptions can be sent electronically. Is this correct?
Yes, it's correct.
Okay, good. So some pain medications require a paper prescription that you take to the pharmacy to have filled. Please ask your nurse if you have one of these prescriptions because you'll need to take it to the pharmacy to be filled.
Okay, I can do that today because I'm going to go pick up my prescriptions anyway.
So now that we've reviewed all of your medications, let's review the schedule in your discharge paperwork. This schedule shows a list of all the medications you should be taking and the times of the day that you should be taking them. As we go down this list, let me know if there's any medications you're not familiar with.
Okay.
Take the time to review the medication schedule with your patient and answer their questions and concerns. Confusion about medications is a common complaint from patients, and it can increase their risk of readmission. Taking the time to review the medications now can help prevent complications and non-compliance. I do want to make sure that you understand what each medication is for and how to safely take it at home. Can you tell me when you're supposed to take your Plavix and what it is for?
Okay, according to this, I take the Plavix once a day in the morning, and it's a blood thinner to keep my blood flowing through my new bypasses.
Exactly. It's important to assess your patient's level of understanding by using the teach-back method. Asking open-ended questions will help you determine any gaps in learning. For your safety, it is important that you take your medications as prescribed by your doctor. If you have any questions or concerns, please do call your doctor. Do you have any questions right now about your medications?
No, ma'am, I think you've covered everything, and if I do have questions, I'll call the doctor.
Oh, wonderful. Well, it's been a pleasure meeting you, and thank you for choosing Houston Methodist.
Nice meeting you too. Thank you.